for today's video. I did a little bit of research because I wanted to reach, or I guess help, as many of you as I could, and it looks like the #1 prescribed medication, at least at this point right now, is Synthroid, which is the brand name. The generic is levothyroxine. And so I don't know why I've never made a video on it. I thought that I did, but I guess I never did. So here's your video. Some important things to keep in mind. It is a hormone and it's in a pregnancy category A. So what that basically means is you can get pregnant and take this medication and there's no harm to the baby. Reasons that Synthroid would be prescribed. If you have a low thyroid level, then Synthroid would be prescribed to boost it up. And here's an interesting thing with the thyroid hormones. TSH, which is the thyroid stimulating hormone, if the TSH is elevated, that indicates that you have hypothyroidism. If your TSH is low, you have hyperthyroidism. If it's elevated, you have hypo. So it's backwards with the TSH, and I probably just totally confused you. It can be given by mouth, that's the most common, but it's also available in injection form and IV form. It can also be used to suppress thyroid cancer, which I was pretty surprised about. Some reasons that you wouldn't give it, so it's totally contraindicated: if you're allergic or sensitive to any of the ingredients, hyperthyroidism, or a recent heart attack. Side effects are, sweating, headache, hyperthyroidism, and weight loss. So it's going to take a little while to find the right dosage, and if your dosage gets too high, it's going to throw you into hyperthyroidism. But that's corrected by the medication. It's medication caused. Nursing implications would be blood pressure and apical pulse. You need to assess those. And also, you need to assess for chest pain. And then two separate things: dysrhythmias and tachycardia, and then the two of them together. And then for the medication itself, you have to take 30 minutes to an hour before you eat breakfast. This therapy is usually lifelong. And then you would need to follow up with your primary care, or I guess with your prescribing doctor, to monitor your progress on the medication, so that way they can make any kind of adjustments that are necessary. If you have any questions, leave them below and I will answer them.